The M.E.A.T strategy. M.E.A.T is the best method to assess whether the documentation supports every single risk adjustment diagnosis reported in the notes. The M.E.A.T strategy answers two important questions. What clinical or paraclinical indicators lead the healthcare provider to make the diagnosis? How does the healthcare provider manage the patient's illness or condition? M.E.A.T is an acronym. What does M.E.A.T mean? M stands for monitor. Physicians monitor the patient's disease every time they document the sign, symptom, progression, or regression of the disease. E stands for evaluate. Physicians evaluate the patient's disease every time they document the test results, the effectiveness of the medication, and how the patient responds to treatment. A stands for assess. Physicians assess the patient's disease every time they order a test, discuss the case, review a report, do counseling, refer the patient to a specialist. T stands for treat. Treatment is reported whenever physicians document the medication associated with the disease for which it is prescribed, and the type of therapy. Once documentation meets the M.E.A.T, all risk adjustments get supported. We could never overemphasize enough by repeatedly saying that the codes reported on the claims must always be supported by documentation in the medical record. From Module 1, we learn that if not supported, the risk adjustment diagnosis does not exist. A physician will use clinical knowledge to arrive at a decision. But if that decision-making is not included in the documentation, another provider using that documentation will miss valuable information that could assist in the patient's care. The physician is responsible for maintaining accurate and complete medical records for each patient with Medicare Advantage coverage. All diagnosis codes submitted on a claim must be supported by documentation from a face-to-face visit. And the physician must make sure that submitted diagnosis codes meet the risk adjustment submission requirements set by the Medicare Advantage plan. Otherwise, the plan can decide the diagnosis is not supported and not valid. Once you are sure all diagnoses are supported, it is time to submit claims.